Right. Good morning. Good morning, everybody. It's great to see everyone today. I'm super excited to get you started on your weight loss journey, your health journey process. My name is Dr. Diana Lane, and I will be your bariatric surgeon. Welcome to Body by Bariatrics. All right, let me share my screen very quickly. Okay. So, the first thing is I know that having Zoom as part of your healthcare is probably a little bit weird for some of you guys, but here at Body by Bariatrics, we truly do love it. What are we going to talk about today? So the first thing that I want to talk about is I want to tell you guys about me, about my journey, why really it is my passion to be a bariatric surgeon to really help you guys out on your journey. I always say that you guys are now family, so welcome to the Lane family. And I will be here for you throughout your entire journey. Secondly, we're going to go over why is Body by Bariatrics so special? So our patients, number one, not only lose more weight than the national average, but also keep that weight off. And I truly believe it's because of everything that we have here to offer. Lastly, we'll go over how I'm going to get you right here to the operating room and as quickly and efficiently as possible. Right now, our average is about 5 weeks from the date of your initial consultation. So that is today, which is great. Now, I know some of you guys will have a little bit longer wait period, just unfortunately because of your insurances. But if not, the sky is the limit. We can get you to the operating room as quick as possible. And then lastly, we will also go over the actual operations that we have to offer you and why you should probably choose one versus the other. So let's get started. Again, welcome. My name is Dr. Diana Lane, and I am super excited to get you guys started on this process. So, why has it been really my passion to really become a bariatric surgeon? And it really did start probably when I was a little kid. I have always struggled with obesity. I've always struggled with my weight. And I remember just going into the pediatrician's office and always being in that 99th percentile for my weight, despite being a competitive dancer and cheerleader. So I was never not active and I was eating the same thing as the rest of my peers. Now, fast forward to residency where I gained about 100 pounds, and it was because I wasn't eating and I was under a lot of stress. Um, Now, what is very interesting is that that's when I first started learning these surgeries. And one day, my boss or my attending basically said to me, "Oh, I believe it's just because people need to learn how to eat less." And that is when I was super kind of offended because I knew that I've been eating less my entire life and it never worked. And I always were on those 1,000 fad diets and kept on gaining it back. And it kind of really upset me that he was the one helping and was the bariatric surgeon and was supposed to be there for everybody during this crazy process. Um, and so I truly believe that obesity is a disease. It's like hypertension or anything like that. I do believe that it is genetic. It does run in families. I believe that it has to do with your environment. So it's not just one little thing that, oh, you decided to wake up one morning and eat more calories. It's just not the way that it works. It's a very more intricate and an advanced thing. So also, I kind of hit on that I do believe that it runs in families. Obesity does run in my family. Everybody struggles with it. A lot of my aunts and uncles and my mom have actually already had bariatric surgery. I have not. But my mom actually had it in 2000. When they first started doing the surgery, it was kind of like voodoo magic at the time. They were actually, they kept her in the ICU, which is crazy because now you guys go home same day. But she was able to lose the weight and keep that weight off. And I truly believe at 62 years young, she would not be where she is today. For example, in November, we went on a Hallmark Christmas cruise and we went to the Bahamas and she was able to walk the entire town and also go and snorkel with us all day. And I truly believe that if she did not have that surgery in 2000, she would never be where she is today. And that would really kill me because really she is able to enjoy everything. And I want the same for you guys. I want you to enjoy a healthy lifestyle and really enjoy everything that life has to offer. So again, welcome, welcome. I always say that you guys now are a part of the Lane family. If you need anything, I can easily just pick up the phone. You can see me. We are 100% virtual practice, which is kind of great because I can get on whenever I have free time and see you guys if you have questions. Also, we have our texting format that either my PA, Amber, who's also amazing, Hannah, we can all answer your questions. So please don't hesitate to reach out if you guys need anything. All right, so why is Body by Bariatrics so special? I kind of hit on that we are more of a concierge type practice. We do text you guys a lot. We are available. And with that, Hannah Schuyler, she is our registered dietitian. She is actually available to you at any time during this process. Some of you guys will actually need to see her just because of your insurance requirements. But if not, she is always here for you. So she all has so many different ideas because really nutrition is a big part of this. The surgery is really only just a tool. And Hannah has a lot of different recipes on hand and things to really help you make the change and make this a lifelong change and not just, one of those fad diets that I'm sure everybody here has been on. So it's really important for your success to have a dietitian by your side. So please let us know if you need to see her. She is available. She will also be able to see you very quickly. All right. So another thing, Hannah and Dr. Dovek have an amazing podcast, the Weight Loss Collab, and she really they talk about bariatric surgery, so many different aspects of it. The first season is really about, the nitty-gritty nutrition ideas and about the surgeries, and then the second season is more about relationships and abstract things that you wouldn't really think that bariatric surgery touches on, but it really does. Another thing that I want everybody here to go on and watch, and you can really, this is on YouTube, something that you can actually watch the video, is the sleep week and the bypass week. Dr. Dovek actually goes through every single surgery and explains what we do during each part. And what's awesome is that every single surgery, because that is the only thing that we do, all we do is bariatric surgery. It looks almost the exact same. So we strive for perfection. So that is exactly what we want. So I highly recommend that you guys go on there. If you are squeamish, like my husband, he cannot watch any of my videos, don't go on there. But if not, I highly recommend that you guys go on there, watch the video to really know what happens when you guys fall asleep. All right. Another thing is that we are very, very, very active on social media. I've already seen some of your names request to follow me. So hello, welcome. And this is kind of like Instagram is kind of like having my own personal cell phone number. When you guys text, I'm available. I run my own Instagram. So if you have any questions or anything like that, please, again, you can reach me out on there. Also, I do love hearing and seeing check-ins with my patients because remember, we only see you a little bit after surgery, but it's really great to see how you guys are doing and the progress that you guys are making. And so I love to be tagged and things like that. So please make sure that you follow me. Also, Hannah Schuyler and Body by Bariatrics is also on Instagram. Super fun. Definitely recommend that you follow them. All right. One of my favorite things that we have to offer here at Body by Bariatrics is the weight loss and bariatric surgery support group. Now, Dr. Dovek started this support group 10 years ago, and we have about 10,000 different members, which is amazing. This has patients that maybe haven't had surgery yet, or had surgery 10 years ago. And it really does have a place for support. It's where strangers become friends. And it's these people that are really going to go through it with you because they've been through it before. So if you need a support system, I highly recommend that you join this group. I know that just recently, a group of bariatric patients actually went out to lunch and enjoyed a day of fun. So highly recommend that you get on there and see what it's all about. Now, what's also kind of linked to this bariatric surgery support group is also every third Tuesday of the month, we do have a live support session. This is through Zoom, and we will remind you through this group. So it's been amazing. We've had over 100 different people that have joined. So I definitely recommend that you join this so you don't forget about those third Tuesdays. Now, finally, my favorite thing about this group is where we see the NSVs or the non-scale victories. And this is really what this surgery is about. I know everybody wants to get on that scale and see that weight drop, but what is really rewarding is really the NSVs. And so, what are these? So, I know this happens a lot during Christmas when you get on an airplane and you're able to sit in that middle seat and you have all this space around you, and you don't need a seatbelt extender. And that's one of them. We get a lot of those pictures. Also, we live in Orlando, so many different people are able to walk the parks and not have to, be tired and take a rest. You're able to go on Velocicoaster and fit on Velocicoaster and not feel uncomfortable. So many different things that NSVs can have. And I have to say, my favorite one, and this now happened over a year ago, a woman said that her son was able to finally hug her and touch his hands around his mom's waist and said, "Mom, I can finally hug you." And that literally brought a tear to my eye because you really don't know what you're missing out until little things like that happen. So NSVs is what really keeps you going on this journey. All right. So how am I going to get you right here to the operating room and as quickly and efficiently as possible? Um, we have already gone over all of your insurances to make sure that we have everything that we need for you to be approved by your insurance. Now, in our one-on-one, you will get this insurance checklist sent to you, and please make sure that you check all of these things. Now, this is not a whole list of what you will have, but this is just a list of some things that you might have. So a lot of your guys' checklist is much, 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 much shorter. But just know that this is what it will actually look like. Again, we do have the best self-pay pricing in the country, and please let us know we do have care credit options when it comes to your deductibles and things like that. Now, what is your timeline to surgery? Number one, we already know that you've made the decision to change your life. You finally decided to make that big leap, and you went to BodyByBariatrics.com. You clicked get started, and now you're in this group session right now. Now, after this group session, we will have a one-on-one directly with me in the Hilo Patient Portal app. Thank you guys all for answering all of those questions. If you have not answered those questions, please make sure to answer them ASAP, as this is all the nitty-gritty, tiny medical details that I need to go over with you. And it also gives me more time to kind of get to know you and your journey. Now, during this one-on-one session, you will receive again that checklist that I kind of showed you before. Again, it should be a lot smaller. Usually you guys have a lot less checklists. Now, what can be on this checklist? So number one, everybody here will have to complete NutriHealth. This is essentially the nutrition guide for this surgery to really teach you everything that there is to know nutritionally to be successful on this journey. Now, this is an online module-based system. It's about 12 modules. You'll have to, number one, read an excerpt, watch a video, and then finally answer a quiz. Now, that quiz is not a pass or fail quiz, but you are only able to take it once. We need to make sure that you truly understand this material because, again, it is super important for you to really understand and be successful on this journey. Now, if you are having trouble, don't worry. Hannah is there to kind of go through everything with you and answer any questions that you have about Nutri. Now, what else can be on this checklist? One thing I am going to point out, because almost all of you will need a psychiatric evaluation. It's something that all of the insurances require. This is, if you already see somebody for mental health, perfect. We actually have a resource for you. If you go to bodybybariatrics.com/resources and you go to the psychiatric template, you'll be able to print that out and give it to your mental health provider. This can be a psychologist, psychiatrist, social worker, nurse. I don't care. Whoever sees you for your mental health can print this out and fill it out for you and send it back to us. Now, if you do not have somebody that you see for mental health, don't worry. We got you covered. We have an online virtual psychology practice called Advantage Point behavioral.com, and they have so many different options and times to see somebody, and please let them know that you're with Body by Bariatrics because they know exactly what they have to fill out and send back to us. It does only take 2 to 3 business days for them to do that. So it is very good to kind of get you through that process a little bit quicker. Now, some of your insurances will not cover Advantage Point Behavioral. So please, again, let them know that you are with Body by Bariatrics, and you will get a discount of a total of $120. So it will be $120 for you to not only see a psychologist, but also for them to write that template out and get us that within 2 to 3 business days. Now, finally, once you complete your checklist, you will be invited to a final group session. And in this final group session, we will go over the bariatric surgery success guide. And this is why this is actually on the checklist, because before we go to the final group session, I want you to read this bariatric surgery success guide like 3 times. It's a 60-page document. It's not like Times New Roman like 10. It's very big and a lot of pictures, but it does explain everything about the surgery. So, what you have to eat, what your restrictions will be, all of that stuff. So please make sure that you read this in its entirety before you go to that final group session. Now, again, I said in that final group session, I will be going over the bariatric surgery success guide. And I will be able to answer any questions that you guys will have. After that final group session, we will have a one-on-one with me in the Helo Patient Portal app. And that's where we will get your surgery date. So I have a little bit of a preference for final group sessions because it is really exciting. It's an exciting day for you guys to finally get your surgery date. So it kind of becomes real at that point. So I cannot wait to get you guys through. If you have any questions, again, we are here for you at any step of the process. Also, during this process, you will be hearing a lot from Leslie. She is our patient care coordinator. She's absolutely amazing. I love her. She will actually help you if you have any questions on any of those checklist items to help you get those done so you get through the process and we're not wasting any time, especially if you definitely need something for your insurance. She will make sure that you have it. All right, so let's start talking about the actual surgeries. Now, with the actual surgeries, we 100% do these laparoscopically, so minimally invasively. So what does that mean? That means that every surgery that you are getting, whether it's the sleeve, the gastric bypass, or a revision, it will be done in 4 incisions. That is it, just 4 incisions. 2 piggy-sized incisions on the outside of your belly and 2 right next to your belly button. The incision on the right-hand side is going to be a little bit bigger, and that's to fit a little bit bigger instruments. And so you'll see it's just a little tiny bit bigger than a pinky size. Now, this is the most minimally invasive as possible. So if patients say, oh, well, one surgery is more invasive than the other, the answer is no, it's not. You guys literally have the same 4 incisions. So on the outside, you would never know if you had, a sleeve or a bypass because they all look the same. All right, so let's start talking first about the laparoscopic sleeve gastrectomy. Now, in this surgery, I take the stomach from the size of a football down to the size of a banana. Once we put you completely asleep, we put what's called a bougie down your mouth, into your throat, and down into your stomach. And again, you are completely asleep. And this is our sizer to make sure that we can make your stomach as small as possible, but still as safe as possible. So I go along this bougie and I staple along it to make that stomach the size of a banana. This part of the stomach will actually be taken out through that bigger right-sided incision and we throw it away. Now, this surgery is not reversible because I am throwing away part of your anatomy. We do have to talk about some things with this surgery. It's not the best surgery, if you ask my opinion. So number one, it causes reflux. 30% of patients actually have found that they have reflux symptoms after this surgery. And why is that? Because essentially, if you see this part right here, there is a little stricture, and that's called the pylorus. This is a sphincter that opens and closes in response to food. Now, think about a hose. If you have a hose going and you kink the hose, what happens? That build-up pressure happens, right? So the water comes out faster with more pressure. Also, it kind of the same thing happens here. Once I take out 80% of your stomach, what can happen is that you have increased pressure, which causes anything that you eat or drink to be pushed up into your esophagus, which is why 30% of patients that have the sleeve do end up having reflux and will have to be on reflux medication for life, unfortunately. About 5% of these patients have it so bad that they actually convert to from a sleeve to a gastric bypass. So if somebody asks me what's the most common procedure that you need a redo procedure on, it's going to be the sleeve. Okay. If you already have reflux, I do not recommend this surgery to you. If you have any type of hiatal hernia, diaphragmatic hernia, you would know if you had this because you've had to have some kind of imaging or camera down your throat looking at your stomach. If you have this, I do not recommend this surgery to you. Your percentage of reflux is much higher than the baseline average patient. Now, when it comes to weight loss, so with the sleeve gastrectomy, we're seeing in 10-year studies that you are only losing about 50 to 60% of your excess body weight. So what does that mean? That means that if you right now are 250 pounds and your goal weight is 150 pounds, that's 100 pounds of excess body weight. Okay. So that means that with the surgery, you will only be losing 50 to 60 pounds of that weight. Okay. And if you have any type of metabolic syndrome like diabetes, PCOS, infertility, insulin resistance, I don't recommend this surgery to you because it's not actually helping any of that metabolic syndrome. It's only constricting what you're eating and changing the way that you feel hunger. Also, we are seeing higher rates of weight regain with this procedure, especially at that 5-year mark. All of this is actually new data that has just come out because we finally have 10-year data in our research. So, who do I recommend this to? So let's say that if your BMI is less than 40, and that means that you don't have that much excess body weight to lose, and you don't have any diabetes, PCOS, or anything like that, I would recommend this surgery to you, because it's better for that BMI less than 40, where you don't have that much to lose, but you do have some to lose. All right, let's start talking about the laparoscopic Roux-en-Y gastric bypass. So again, this is done through those 4 incisions. Again, you don't know whether you had a bypass or a sleeve. So please make sure that if you again think that one is more invasive, it's not. It only has those 4 incisions. And actually, what's great is that because in this surgery I don't take anything out, it is completely reversible. That right side incision, where with the sleeve I had to take out that stomach, you don't have that much pain there as you do with the sleeve because I don't have to take anything out, which means I don't have to actually on the inside suture the muscles together to make sure that nothing bad happens with the hernia. So again, it's also less pain, which is very surprising. All right, so what is this Roux-en-Y gastric bypass? The first thing that I do is I take your stomach from the size of a football down to the size of a thumb. I then completely rearrange your small bowel and skip 270 centimeters of your small bowel and connect it in that Y fashion. That's why you see a Roux-en-Y gastric bypass. Now, digestion actually occurs at this junction right here at the Y, and then everything kind of goes and digests the exact same way, your food, the way that it always has been. Now, the reason why that this is going to be better than the sleeve is because when we actually rearrange that small bowel, that's where we have that change in your metabolism. So we are seeing with this that if you are not on insulin, 96% of your diabetes is completely away if you do have diabetes. We see reversal of PCOS. We see help with infertility. And also, if you have any type of autoimmune disease or inflammatory condition like insulin resistance and things like that, also rheumatoid arthritis, a lot of you guys have Hashimoto's. You'd be very surprised how many people that I see that are like, oh, I have hypothyroidism and also Hashimoto's. It's very common because those two things are kind of a recipe for gaining weight and not being able to lose weight. So this one is going to be the best for you. It does not eliminate those diseases, but it does significantly improve symptoms because it decreases that inflammation in your body. Now, every time that I talk about, oh, I forgot about this. So, the laparoscopic revisional bariatric surgery. If you have a band, if you have a sleeve, and you need a revision, you will be revised to a bypass. Okay. This surgery will take a little bit longer than the average, again, because I have to take out the band or kind of figure out the anatomy after the sleeve and take down those adhesions and scar tissue. Okay. Now, anytime that I talk about surgery, I do have to talk about the complications of bariatric surgery. Now, the first thing that I want to say is bariatric surgery is actually safer than the most common surgery done in the United States, which is the laparoscopic gallbladder removal or the laparoscopic cholecystectomy, which I'm sure some of you actually probably already had. Now, anytime that I do surgery, there's two major complications that we have to talk about, and that's any surgery, not just bariatric surgery. The first one is going to be bleeding. So anytime that I, staple intestines, staple stomach, do anything, it is a very vascular structure. So you have the risk of bleeding. Now, we make sure obviously that there is absolutely no bleeding when we come out of surgery or right before we come out of surgery. But the most common form of bleeding is actually you will tell me, hey, Dr. Lane, you're a couple of days out and you'll be like, well, I have some black stool. And that means that you bled just a little bit from those staple lines on the inside of your gut, and it makes your stool black. And over time, the black stool becomes lighter because it only bleeds very, very minimally right after surgery. Again, nothing to worry about because there's nothing really to do. It's so little amount of blood can make your poop black. So that's what most patients get kind of freaked out about. And then secondly, we do have to talk about infection. The most common form of infection is going to be on that right-sided incision, where you'll get maybe a little bit of redness or puffiness, and we'll look at it and be like, yep, it definitely looks like it's infected, and we give you some antibiotics. Again, very rare because we do the procedure sterilely, but those are actually the most common forms of complications after surgery. Now, I do want to talk to you about the most complications directly proportional with bariatric surgery. And again, this is so rare. These complications happen 1 in 1,000. So the first thing that I do have to talk about is leak. So anytime that anybody uses any type of staple device, there is a chance of leak. So that happens at this big staple line here with the sleeve, and also here and here with the gastric bypass. Now, leak kind of scares everybody, but again, very rare, 1 in 1,000. Why? Because we actually test to make sure that there is no leaks before we leave the operating room. And if there is a leak, we actually fix it while we're there. So that's why it's super rare. But if it does happen, we actually just admit you to the hospital. We change the way that you eat for a couple of days and we drain it, and it actually fixes by itself. Okay. Now, the other complication that we have to talk about just has to do with the Roux-en-Y gastric bypass, and this happens in 1 in 500 patients, okay? And this happens when you actually lose a lot of weight. So this doesn't happen immediately after surgery. It happens about 6 months to a year after surgery. And what is that? So the way that I always explain an internal hernia is with a bag of marbles. So let's say that you have a bag of marbles, you fill the bag of marbles completely up, and then you shake it. Those marbles don't really move that much, right? Because they don't have space to move. So that is kind of like what your abdomen is like when you have a lot of that excess fat on the inside. Now, once you lose that excess fat, it's called adipose tissue, and visceral tissue. A tissue that's actually fat on your organs. Your organs have a lot more space to play around and move, right? So that's like taking a bunch of marbles out, throwing them away, and then shaking that bag. That same bag, now those marbles will move around a lot, right? It's the same thing. So now your intestines are able to move around a lot. Now, what can sometimes happen is when they are moving around, they can kind of flip on each other and cause what's called an internal hernia. Now, what happens with this is that this is the only time that we will have to reoperate on you. And this surgery actually only takes about 20 minutes. We take it out, look at where that point is that they're wrapping around, and then we fix it. Now, the reason why, again, this is so rare is because we actually fix it during the initial surgery. So we actually suture where those intestines can kind of go around and cause an issue, which is why, again, this is so rare because we try to fix it at the beginning so it doesn't happen. Okay. All right. So I know that we have talked about a lot. I know you guys probably have a lot of questions. I can't wait to talk with you in our one-on-one on the Hilo Patient Portal app. If you have not answered those questions, again, please answer those questions because it really does give me enough time to kind of get to know you, your journey, and things like that. I'm so excited to get you guys started and to meet you guys. And we will see you soon here in a little bit. We'll see you later. Bye.